Hi, this is Mia Nease for MGT 616 Unit 3 assignment. This is part 2 of the presentation, and it is a discussion that is aimed at staff and followers at Springfield General Hospital. The agenda of today's presentation will look at what the issues are that we're trying to tackle and why we need to change them. We will talk about the change process and what the roadmap will look like. We'll look at which stakeholders will be affected and also what the drivers are. And we'll conclude with questions and answers. It's indeed a very sad situation when in our hospitals across the country, every year medication mistakes account for 770,000 hurt or in fact killed patients. And one of the key problems here is that we still have a lot of physicians who are handwriting prescriptions. And if you've tried to read a doctor's script lately, you'll know that they're actually pretty hard to read and nearly ineligible. And because of that, there's a lot of confusion. Drugs have similar names. Sometimes it's difficult to decipher which drugs interact with the others. And because there's no connectivity to the electronic health records, it's also sometimes difficult to ascertain whether a patient is allergic to a drug. And here at Springfield, while we do a tremendous job with our patients, we are actually, in terms of adverse drug events, performing under national standard, and that's what we're looking to fix. We are looking to implement a computerized physician order entry system, and we've read lots about this. Lots of literature suggests that it's going to make a big difference in reducing errors. And so the rollout will take place over the next 6 months. It's going to happen in 2 phases. First, our technology team will be entering all the information into the system, and then secondly we will be integrating it with our electronic health records, and then at the end of the 6-month period we'll go live, but we will also be monitoring very heavily what the results are and to make sure that we continue to see a reduction in errors and a reduction in suffering of these patients. The particular system was chosen by our administrators, and we believe it's going to have a broader impact. Our technology staff have been working really hard, and here at the hospital, the people that are going to be most affected will be the clinical and pharmacy staff. As a broader population, you probably won't see all that much of an effect, but what we hope is that you will see the output of this change, and you'll see a tremendous improvement in error rates. As you know from life in general, technology is everywhere. That is the same here in hospitals. And we've read several studies that suggest that a system like this is going to reduce medication errors by up to 81%. We have lots of advocates for this technology, our researchers, our clinicians, our administrators, pharmacists, business council, even politicians. And of course, we've heard from many of you. And, you know, of course, the patients themselves want to see improvements. So there's technology drivers, but there's also drivers that are just generally from the community with a desire to make a difference. So in summary, we have a problem with medication mistakes, and most of you are aware of this. And to solve this problem, Springfield General is implementing a computerized physician order entry system, also known as a CPOE. Many of our hospital peers use it, and there is lots of proof that it will help reduce medication errors, drug events, and of course human suffering. The rollout will impact several stakeholders, but obviously we do hope that the most impact will be on the patients. And our go live date is in 6 months on March 1st, 2020. So I would like to open up for questions if you have any right now, or please forward them to me via email. Thank you. This slideshow was assisted by several references, our textbook Implementing Organizational Change, as well as journal entries from Grady and Koppel.